you so much for joining us. So can you tell us a little bit about your role in Medicine X?
My role is to support Medicine X, to be here to cheer Larry and the great team that have put together this wonderful conference, and to learn from the conference so that we can implement the ideas and the programs that emanate from the discussions here over the next couple of days.
You do a lot of work actually with big data in biomedicine. Can you speak a little bit about why that is so important?
Big data is fascinating from a number of points of view. One is that ever since the discovery of the double helix and the whole revolution in molecular biology, biomedical research has been hypothesis-driven and fairly reductionistic in terms of how we've thought about understanding biological systems. And that is certainly not going away. There's still a lot of amazing science to be done. What big data does is to look at a different approach, and that is how to take in massive amounts of data without any suppositions about relationships, and then to, from analysis, infer and discern relationships that may exist among different parameters of the data. From that, one can then develop testable hypotheses that drive scientific advances. But it's really a revolutionary new way of thinking about getting information from scientific studies.
So what you're speaking about is personalized medicine. In other words, getting data from a person or their cancer and then using that information to help direct their therapy?
That's right. That's certainly one example of precision or personalized medicine, yes.
So is the advantage to big data that we don't have to necessarily create new experiments and use money and resources to do that, but we can look at existing data and compare that?
So that's one of the advantages, is that there is a treasure trove of information embedded with the massive amounts of data that exist, both in clinical informatics, from clinical databases, and also increasingly from genotypic studies. And that information requires specialized scientific analysis. That data analysis requires specialized scientific and statistical approaches, but in developing those approaches, we will glean information that we had never imagined was possible to discern.
How do you think conferences like Medicine X are helping push the boundaries in terms of innovation?
They're pushing the boundaries of innovation because they're bringing together very innovative and creative people, talking about a panoply of topics in an environment that really encourages and supports innovation, which is the environment we have here at Stanford. And I think the environment, in combination with the talent of the people that are participating in this conference, are what underscores or makes possible the success that will come out of the conference.
Well, it's certainly an exciting electric environment around here.
It certainly is, yes.
Thank you so much for joining me.
Thank you very much.